Dark circles, under-eye hollowness, and puffy eye bags cause people throughout the world to desperately try home remedies like tea bags, creams, and obsessively search the internet for medical treatments. On top of that, the cosmetics industry makes billions on makeup and concealers for these very common problems. People from around the world have come to see me because they are bothered by how tired they look when they see themselves in the mirror or in photos. They frequently tell me that they are constantly being asked if they're tired, if they had enough sleep, or if they're sad or upset. From a social science perspective, this is consistent with research that has established that judgments about our confidence, trustworthiness, and emotional state can happen in as little as 1/10 of 1 second through eye contact. As an eyelid specialist for over 30 years, I'll share my insights on how I help people with under-eye dark circles, hollowness, and eye bags. To begin with, I found that people often assume that they have only one issue, such as dark circles. In actuality, you can have one or more overlapping conditions, such as dark circles with hollow under eyes and puffy eyes all at the same time. Yes, you can have more than one diagnosis. So how do we make sense out of this? A basic understanding of the anatomy and other variables such as sinus problems, lack of sleep, allergies, eye rubbing, diet, and genetics can help you choose the best options for your situation. Speaking of genetics, it is very common for people of Mediterranean, Middle Eastern, South Asian, and of African heritage to be aware of the skin pigmentation under the eyes being a family trait. At the same time, sun damage and age-related changes can make the skin under your eyes look dull and darker. People with lighter skin of European heritage can also have dark circles caused by sun damage and aging. I have helped people of all skin types improve their skin quality with PRP, or platelet-rich plasma. Platelet-rich plasma is the concentration of wound healing and growth factors in the blood that are activated after an injury. These growth factors stimulate the production of collagen and new blood supply, resulting in healthier and more vibrant skin quality. For people with lighter skin to Mediterranean skin, we also have several different lasers which help renew the top layers of skin as well as strengthen the backbone of the skin called the dermis. I routinely perform fractional CO2 and erbium laser for people with lighter skin, which has a few days of downtime. I also perform a no downtime long pulse erbium laser called Smooth Eye, where people come in over a few sessions and have smoother and tighter skin, again without any downtime. Dark circles can also be due to hollowness at the bone structure level. There are 3 key points that I evaluate when I look at bone structure. I look at the tear trough, the triangular area just below the center of the eye, and the high point of the cheekbones. I routinely enhance areas with volume deficiency at the bone level with a technique called structural volumizing. Structural volumizing is a technique of hyaluronic acid filler placement derived from methods used for surgical facial implants. This contrasts with conventional filler placement, which is just below the skin and often leads to problems such as filler migration. At the bone level, hyaluronic acid fillers such as Restylane and Juvederm can be stable like facial implants and do not migrate. The areas treated look more defined and feel like your natural bone structure. This is an art, and enhancing areas such as the tear trough, under eye, cheek triangle, and cheekbones requires technical precision and artistry for natural results. A very common situation is where bone deficiency and hollowness is accompanied by puffy under-eye bags. Puffy bags can also be perceived as dark under-eye circles. However, the puffy bags project forward and have a distinctive appearance. These bags are caused by the forward shifting of fat compartments, which is referred to as fat herniation. These under-eye bags are present regardless of how much you sleep or take care of your sinuses and your allergies. In fact, the presence of under-eye bags is oftentimes a genetic trait. Over my 30-year career, I've been operating many times on 3 generations in the same family. Additionally, age-related bone loss can also contribute to this forward herniation of fat compartments. When fat herniation is limited, I can precisely place hyaluronic acid filler in areas such as the tear trough to address the adjacent hollow area and reduce the contrast between areas of too much fat with areas of too little bone projection. When herniated fat projects out too far to manage with filler, the fat needs to be reduced. When you research procedures to reduce under-eye bags, the messaging about who is the best surgeon does little to provide helpful insight about how a surgeon's approach to this problem is right for you. So, I'll share with you how I developed my approach to help people of all ages and skin types with under-eye bags. In the early 90s, I trained in oculofacial plastic surgery after completing my residency in ophthalmology. Training in oculofacial plastic surgery is highly specialized, so you can manage a range of anatomic and functional issues to help people with cosmetic and reconstructive eyelid problems. Unlike other cosmetic surgical procedures, eyelid surgery can impact the health of your eyes and your vision. Conventionally performed eyelid surgery called transcutaneous blepharoplasty, where an incision is made below the eyelashes to reduce fat and remove skin, all too often causes people to lose their original eye shape because the eyes would become rounded and pulled down, revealing the white area under the colored part of your eyes called the sclera. We actually call this scleral show. Not only does this change the character of your appearance, but also causes problems with too much eye exposure, such as dry eye. My aesthetic is to preserve the eye shape and to address any eyelid support issues to minimize the risk of eye and vision problems. The conclusion I came to is that eyes that look good function well. I routinely perform surgery for under-eye bags from the inside or behind the eyelid, called transconjunctival blepharoplasty. This approach is technically advanced as the space to work in is smaller and narrower, than when surgery is performed from the outside. A major advantage to this approach is that it allows me to preserve the supporting muscles and other structures critical to preserving your eye's shape and health. Skin removal is generally not necessary, as lower eyelid skin wrinkling is not caused by excess skin quantity, but rather by the loss of skin quality. Depending on your skin type, I routinely use different lasers, radiofrequency technology, and regenerative technology, such as PRP or platelet-rich plasma. My patients with skin types prone to keloids are relieved to not to have to worry about scars, since I perform this procedure from behind the eyelid. Additionally, I addressed another major concern people have about the risks and downtime associated with being under general anesthesia. During my training in eye surgery, I performed delicate surgery such as cataract surgery with local anesthesia. I used this experience to help my patients avoid general anesthesia by performing all of my eyelid and facial procedures under local anesthesia with light intravenous or IV sedation. My patients recover comfortably and return to work and other activities in 1 week. If you're concerned about dark circles, hollow eyes, and under eye bags, I invite you to contact my office and speak to my staff, who will be happy to provide you with information and insights how we can help you look your best.